Hey there, I'm Dr. Ruth Roberts, your pet's ally. Hio and I are here today. Hope that you are all well and enjoying your Labor Day and taking some time off. So, hopefully, because there are a few questions, this means you guys are out and about and enjoying a little bit of family time. So, let me jump over the couple of questions we've got. Jamie was asking last week about something to add to combat muscle loss due to prednisone. And Sita popped in with this supplement called Myos, and and for frame of reference, I think Jesse had a hard time getting his Cushing's under control, and so of course had muscle wasting second to that. So it looks like that's been very effective for her. And it's interesting, I had talked to a company about this type of product, but I could never get, and actually it was a different sort of part of the egg that they were using for restoring youth. Basically, they were saying it was the fountain of youth, like many other companies do. But evidently, this particular supplement uses a part of the egg that's fertile, that's been processed essentially to kind of provide the optimal molecules for for muscle growth. So I'm not sure how much better this is, but if it worked for Jesse, it's definitely worth giving a shot. And I can't see where there would be any downsides. It seems that the only ingredient really is this processed product from the egg itself. So Jamie, if you give that a shot, let me know how it works. I'll be interested because my recommendations of whey protein or collagen don't always produce results for every pup. And then Susie's going to be fostering a 1 to 2 year old Dalmatian Pyrenees. What an interesting combo. Recovering from surgery. And he's been on shelter kibble for about 3 months, and soon he's going to start to be able to have some walks and things of that nature, which is awesome. So she's asking what's kind of the best way to go as far as getting the body back on track, and also also sort of staving off. Yeah, sure, we'll post the link. That may be something of use to you too. So here it is. So it depends. If as far as the fracture site goes, as far as that potentially creating problems um, with the joints, it depends. I mean, did it go across the joint? Is there a screw that's gone through the joint, or is it truly just in the long part of the leg? And so this guy, you're going to want to rebuild muscle quickly. So using something like this or collagen, which I think would probably be a better bet, especially Dr. Axe's product, um, which has the 5 types of collagen that will actually function. So type 2 is important for um, joints. And so if he does have a fracture crossing the joint, then that's going to be super, super important. And adding in some sort of a joint supplement just from the get-go will be important as well. Now, I'm going to also assume that you are dealing with quite a bit of muscle loss secondary to having been sort of down for 3 months, if you will. So again, here's that collagen product, and this one does have um, type 2 collagen as well. So that's the one that's great for the joints. Um, so check that out too, Susie. Let's see if I can get this to work, and it doesn't seem to want to do that today. There we go. Here's this. So, as far as gaining muscle, I think that's going to be super important. The other thing is, too, is this boy has been down for quite some time. So, I think you're going to want to work on gut function as well. And I think that's where, using probiotics and things of that nature are important, but also adding in fibers that will help those good bugs grow. So, things like, beans are great. And all those good deals. I would really kind of go with a general. He's a young, healthy dog. Otherwise, hopefully, so I would go with the beans recipe because that's going to help provide a lot of fiber. Introduce it slowly, and in fact, what you may want to do is on the first batch, do it without beans because you're going to go from really bad kibble, presumably in the shelter, to really high quality food. Do a plan to take at least 10 days to get him onto it. So start with something like 25% cooked food, 75% kibble, and then gradually over those 7 to 10 days, switch him on to full cooked food. And then the next batch, I would add in some beans and see how that goes. So that's really going to be crucial. If the um, if the fracture went across one of the joints, then you really are going to have to be focused on protecting the joints from inflammation and developing arthritis, and also using um, rehab steps, and I'm sure you've got a wealth of folks to work with there. So, which beans to start? Susie is asking. I would say start with something easy like lentils. They're more easy to digest, and then move to something like field peas or kidney beans or black beans later. Those tend to be a little bit more difficult to digest. Um, and then we do have sorry, we do have a Labor Day sale going on, and Pam's asking about which consult, and so because you're an iPets Ally member, you get a $50 off of the consult usually, and it is normally this one is what we recommend, the Optimal Health Package. That's this one. And for those of you that have not done consultations, it's doing weird things and slow and weird logging in. So, Pam, do you mean you're having a hard time logging into the store or into the website? Um, so we're doing some, always doing updating. But this is the consultation package. We'll go through um, all of the medical records and the whole 9 yards. And for Spirit, he's kind of catching up on things. So let me pop back over